Right. Good day to everyone. And let me just say thank you to the organizers for inviting me to present at this very timely conference. I want to just say again how honored I am to share the same space with Professor, Professor Winston Davison, because only recently we had another health concern in the western end of the island. And the two schools, the School of Building and Land Management through the Faculty of the Built Environment and the School of Public Health, collaborated to try to see if we could forward advance some solutions. And here we are again seeing COVID-19, and we are trying to examine how it has impacted on the build space, and how together both schools now can try to join together to see if we can find a solution to this issue. So again, I'm happy to be here, happy to participate into this virtual conference. My presentation today will follow the list as you see here on the content slide. I start by looking at public health and to see what that is all about. I want to look at the history and development of public health and geographical information system. I want to speak about geospatial technology, the key theme this evening, and to look at how GIS is used in public health, and to look at incidence versus prevalence. And then we can look at some of the steps for GIS and public health projects. Then we'll quickly look at some of the aspects of global transmission and look at national transmission. I'd just like to say, not so long ago, I mean, only two years ago, or maybe three, in 2017 actually, I was supported by the Caribbean Development Bank to go into Haiti to train some of their workers, public health workers, to use the technology for public health and sanitation. And that was when their crisis was surrounding the outbreak of cholera. And here am I now in my own country in 2020, looking at how we can use the geospatial technology to try to bring some solutions to the crisis occasioned by COVID-19. First up, I would like to define the important term under discussion. Public health is defined as a subject that studies the health of population instead of individuals. It's focused on prevention over treatment and typically operates within the government instead of private healthcare. It is important to note that it's a growing field that is actually turned into GIS for research applications. The history and development of public health and GIS. Over the years, medical or health geography has relied upon geographic techniques such as mapping and GIS to study the impact of a person's surroundings on their health. The literature shows that scientists have used mapping to study public health since ancient times. For example, between the 4th and the 5th centuries, Hippocrates conducted a study of how one's location impacts health. Additionally, some early studies have looked at the correlation between disease prevalence and topographic elevation and found that people living at low elevation near waterways were more likely to experience malaria. This slide, let's try to take a look at geospatial technologies. Geospatial technology refers to a suite of hardware and software that can be used to produce and use maps in a digital format. It can be broadly split into three categories: geographic information systems, global positioning systems, and remote sensing. Let us now examine some of these key terms. Geographical information system actually is the key and central software to your geospatial technologies. It is that software application that allows us to capture, to store, to retrieve, to manipulate, and to allow us to be able to visualize spatial data. The global positioning system utilizes a large constellation of orbiting satellites and via the process of trilateration allows us to get accurate information about our specific location on the Earth's surface. Remote sensing allows us to capture images from spaceborne, from airborne, and from terrestrial platforms. And from those images, we can attract a lot of information about the condition of Earth space. And it's actually remote because we are collecting the information without being in direct contact with the features or phenomena. So how does this all come together? Let us just examine this diagram. And let us start here with the metrics. Objects and phenomena can be measured. They are stored in databases. Geospatial analyses are carried out using various tools. Various information product documents are produced, including our maps, our charts, our graphs, etc., which are used to design and plan approaches, after which decisions are made as to the source of action, as to the course of action, I beg your pardon. Action is taken, and hopefully we'll have some positive outcome that is achieved and impacts positively on our continued existence and occupancy of Earth space. We want to now look at the earliest involvement of GIS in public health. And that would go back to the physician, John Snow. And he actually looked at the cholera epidemic that was affecting England, in fact, London to be specific, in 1854. And there was an outbreak there. And on August 31, 1854, 127 persons died of the disease. And by September 10th, you had 500 deaths. The physician John Snow, through collaborating and talking with local residents and using geographical analyses, he was actually able to map where the deaths occurred, and he was able to map where persons extracted water from the wells to use for their domestic consumption. And by doing that kind of analysis, he was able to identify a cluster surrounding these deaths and identify positively which one of those wells was contaminated. And his instruction or recommendation to the authorities was to remove these well handles or to close these wells. And that was a solution that brought the epidemic under control. John Snow's famous cholera analysis was the first attempt of using data, public data, in modern GIS. As a matter of fact, there is in the literature, a lot of it suggested that John Snow was the first person to engage in GIS, for that matter, even though it was a non-judicial environment. So it was the first epidemiological analysis of disease, trying to understand the spread of case by factors in the environment. It was the first geographical analysis of disease data, plotting points on a map and looking for relationships. That is Robin Wilson's version of John Snow's map. And on this map, you are seeing blue dots and you're seeing red dots. The blue dots are the pumps which extracted the water from the wells. And on the red dots, or their circles, they are the deaths. And you can immediately see that cluster of concern right there. And it's just by shutting down these wells, we could cause a reduction in the transmission of the cholera. So you see that kind of relationship taking place. Now, let us now examine how GIS can be further used in public health. Today, GIS is used in public health in a number of different ways. Before using it to conduct projects, however, it is important to learn the foundation of GIS in public health. In its most basic, GIS answers the question, where things occur, where things are happening. And this can mean questions such as, where are people living? Where are disease starting? Where are the sources of pollution? And the answers in many cases can provide answers to other questions in relation to public health, because maps created in GIS can help to show patterns between things such as disease starting points, risk factors, and sources of pollution. Let us examine two terms that are critical, and their understanding is actually critical to indicate to us how best we can use GIS to solve some of the public health issues. Two terms, incidence and prevalence. Incidence examines the number of new cases of a disease or a health issue over a specific time period. Prevalence is the incidence of existing cases of a disease over a specific period of time. And these are important to GIS applications because a disease that has a fast death rate will have a higher incidence rate than prevalence in a community. And this can allow GIS researchers and health officials to see the distribution of deadly diseases and possibly find the source. The Environmental System Research Institute were the developers for the world-acclaimed ArcGIS suite of software, has prescribed 4 steps for GIS projects that involve public health issues. The first one is assessment. This step involves analyzing the type of data available to determine if it will answer the necessary questions. Maintain privacy, and that is what I heard both from Dr. Archer and from Professor Archer and Professor Davidson. Maintain privacy and meet legal codes, very important. Policy development is another important step. GIS visualizing health data over time to assist with making decisions, policy decisions, setting goals, and evaluating outcomes by linking health data with socio-demographic, environmental, administrative, healthcare, and services infrastructure. Policy development helps to maintain privacy and understand community issues. Then we look at other 2 important steps, operational awareness and assurance. Operational awareness is important because GIS allows health officials to make rapid decisions during emergency, but it's important for them to thoroughly examine GIS results and sometimes analyze multiple data sets to allocate resources and to respond to needs in regards to the current situation as well as future problems. Assurance involves the monitoring of health status to understand and assess factors that contribute to health and diseases, and to communicate and share information with the public, which is very important during the time of a pandemic. Now we can examine 5 steps to COVID-19 response using geographical information systems. The first one, we need to map the cases. So we want to map confirmed cases and active cases. We want to map deaths and recoveries to identify where COVID-19 infection exists and have occurred. Secondly, we want to map the spread, the geographical distribution. How is it moving across the landscape? So time-enabled maps can reveal how infections spread over time and where you may want to target interventions. 3, Map vulnerable populations. I think we have done well with the first two, but I'm not quite sure how well we are doing with this one. COVID-19 disproportionately impacts certain demographics, such as the elderly, and those with underlying health conditions. They call them comorbidity. Nice term. Mapping social vulnerability and other factors help to monitor at-risk groups and at-risk regions. And 4, map your capacity. Map your facilities, employees or citizens, medical resources, equipment, goods, and services to understand and to respond to the current and potential impacts on COVID-19. And 5, communicate with the use of maps. Use interactive web maps, dashboard apps, and story maps to help to rapidly communicate to everyone, so they can stay aware. I have seen some interesting maps being produced by the newspapers, but how well are we using these maps to be able to convey the story? Locally, I'm not so convinced that we are doing the best that we can. But I've seen some coming from other sites in other jurisdictions, and they are using that. Now, let's take a look at what has transpired since January 22nd. And I want to take a look here. January 22nd, see where we were? 555 cases. Yeah? And the new cases were emerging in Thailand, Japan, China, South Korea, Taiwan, and the United States. January 26th, we had 684 new daily cases. And the new cases were coming from Australia and Canada. January 31st, we move up to about over 1,000 cases coming out of Europe, Italy, Sweden, Russia, United Kingdom. Then we move into February. Daily cases, 503. Total cases, 75,000. Here we move on towards the end of February. 982 daily cases, 81,000 total. March, 2,500 cases, daily cases, 92,000 total cases. And as we continue to March 9th, 3,766 daily cases. Total cases, over 100,000. Towards the end of March, 31,000 daily cases. And the total cases, over 300,000. And we can see these dot maps indicating to you the global distribution of the disease. Now, look at this map that we have here. We have seen this nice, beautiful map that's from Johns Hopkins University, showing you how the disease is distributed globally. And of course, the dashboard is interesting because it shows you a lot of the attributes on either side of the main map viewer and indicating to you what is actually happening frequently. Frequently, it changes, so you can get a sense of what is happening. And as soon as these attributes are updated, the spatial data is also updated too, so you can see the transmission graphically. Now, this is Jamaican situation. Prof, my map is a little bit updated that year one. My one is actually, I think, is April 27. This is actually dated now, because I think the last number I heard was sometime 396. Yeah. So, but look at what we have here. This is the situation in Jamaica by administrative region, by parish. Look at where our medical facilities are located. So you can see when we juxtapose the medical facilities, when we juxtapose both of these maps, we can see that it allows us now to be able to track how the disease is distributed across administrative region and to see where they are compared to our medical facilities. At its most basic, it can be used to plan the deployment of resources to regional and local facilities to care for infected persons. and to allow you to introduce strategies to minimize the movement of population to curtail the rate of transmission. For example, that is what is happening in Kingston and St. Andrew. Yeah? And intuitively, you expect that to be happening in St. Catherine, as the professor indicated. But look at what is happening in St. Thomas. Not a lot yet. Yeah? It seems to me that our population tend to move west quicker than they move to east. Look at what is happening in Hanover at the point at this date. I'm not sure that situation has changed in Hanover. But we see where the concentration is. And we know where the facilities are. So we can put the necessary strategies in place to ensure or to keep it localized as best as we can. Now, finally, I wouldn't want to end without looking at the role of mobile GIS. GPS-enabled devices can be used to track the movement of users of these devices, to capture where they are, to store the information, and to do analysis that provides answers to such important questions like their daily commute, where they leave from in the morning, where they go to during the day, where they leave from in the evening, where they go to in the evening. So that is daily commute. It can also look at things like your recreational habits, where you go to for recreation. It can look at your shopping habits. It can look at your religious habits. So we are able to map the interaction of an infected person with the general population. Consider this. Consider the efficacy of doing contact tracing using this method. Food for thought. Consider that. Finally, law enforcement use the tracking devices to monitor the movement of persons in isolation or quarantine. So if you are confined to a particular location for quarantine or for isolation, we can place a GPS-enabled tracking device on you. And if you move out of the area that you should be, of course, the authorities will get a signal and they know. So they can intervene, accost you, and return you to your particular location where you should be, and also administer the necessary punitive fines. Ladies and gentlemen, I thank you very much.